Worldwide, there are more than 17 million deaths due to cardiovascular disease every year. It's a problem that's exacerbated by sedentary lifestyle and poor diet, with cholesterol being a particularly dangerous element. Diets high in fat and alcohol and low in fresh fruit and vegetables are raising the risk of poor cardiovascular health. With this in mind, we're looking at the latest advances in cardiology and how they can help you. American Heart of Poland is a group of interventional cardiology, angiology and cardiosurgery departments in Poland. The clinics were established in 2000 by a group of pioneering surgeons from the United States of America and Poland. We join a clinic in Bielsko-Biała, southern Poland, to find out more about the procedures and the condition itself.
I'm Paweł Buszman, I'm professor of cardiology. We are now in outpatient clinic in Katowice. This outpatient clinic belongs to American Heart of Poland. We are providing the services for patients with cardiovascular diseases. We start from diagnosis, then we decide how we should treat them, and then after the treatment we follow the patients during whole their life. In general, there is a great demand for this kind of services in Poland because from epidemiologic data we know that we have a terrible problem with cardiovascular diseases in Poland. The incident rates of myocardial infarct and stroke in this country is one of the highest in the European Union. But thanks to introduction of the new methods of the diagnosis and treatment of cardiovascular disease, we managed to decrease the rate of death because of cardiovascular disease by 1/3 during the last 10 years. We established the company in 2000 and the aim of the company and our activity was to establish modern network of cardiovascular services in underserved region of Poland. Plus, we believed that having such a system of departments and hospitals will be able to introduce modern and innovative technology even faster than in the university hospitals. I was traveling around the world and I was trained both in Europe, in UK and US, and I met a lot of people, and I met my friends, interventional cardiologists and cardiac surgeons in US. So we decided to build such a new system in Poland based on American experience, but also based on newest technology, which at that time sometimes was even not possible to have even in the US. In this country, but also in Europe, using the newest technologies, we also were successful in introduction not only American technology, but we also introduced to the market Polish technology based on our knowledge coming from outside the country. So it's a kind of satisfaction for us that in some way we are ahead from our US colleagues.
I am cardiologist and head of cardiology department in Bielsko-Biała. We are specializing in coronary artery disease, including acute myocardial infarction treatment. Last year, we treated almost 2,000 patients and we did 1,300 coronary angioplasty. We are working closely with cardiac surgeons, and all complex clinical cases are always consulted by a heart team to offer the best treatment modality.
I run a department which consists of 14 surgical wards, 2 operation theatres and 2 ICU rooms. We performed 2 mid-cab procedures. The first one was the coronary artery bypass, namely a LAD bypass using a minimally invasive or endoscopic method, in which internal thoracic artery, ITA, is used by the endoscopic vision, video fluoroscopy method. The other procedure was a minimally invasive mitral valve repair. Both procedures are performed by a so-called mini-thoracotomy, using small cuts allowing for avoiding a classic sternotomy. The centre has technologically advanced equipment. One operating theatre is a state-of-the-art hybrid room which allows for performing procedures by hybrid teams consisting of, for example, cardiac and vascular surgeons. This approach allows us to perform numerous procedure types untried so far. We have excellent equipment, which allows us to perform procedures by endoscopic vision, video fluoroscopy method. We have 2 video channels and the harmonic scalpel, which allows us to perform such procedures.
So the centers was accepted like a hybrid center for cardiologists and for cardiac surgery. Together work, and one of our operating theaters is a hybrid theater, which allows us to do combined procedures. That is actually in terms of in coronary artery surgery, as well as structural problems of the heart, like valves, like aneurysms. This morning we have done minimally invasive cardiac surgery. That was a mitral valve, which is one of the 4 valves of the heart. In that case, the lady had insufficient mitral valve, which was a great problem, and we fixed it with the annuloplasty. Maybe that's too complicated, but it is a kind of reversing the valve to the good function. And we've done it in a minimally invasive way, which means that you don't need a huge cut in the front of the body, but you use intercostal space on the side with only 5 centimeter approach. Yeah. Many of us are concentrated on the cosmetic point of view and the good look of the scar and the size of the scar, but it's not that important in my eyes. The main thing is that the patient who is operated with this approach will recover much earlier, will have less pain, and will be, last but not least, more satisfied with this approach. He will stay, or this patient will stay shorter in hospital and will be much earlier back in the normal life, his life back in the work. So it's really worth to do it like this. That is the other thing. If you got a bigger incision, of course, bigger approach, you have a bigger surface and approach also for the bacteria and viruses, everything what can contaminate the incision, the approach. So absolutely, that is also a point. Yeah. What about diet? This is actually a question which is very, very popular. In our opinion, this diet which comes from the south, so-called Mediterranean diet, is of course in our opinion the best one. But just a normal diet with less animal fats, saturated fats, of course will help us as well.
I am 34 years old. I am a licensed security service employee. Why am I here? It's a rather strange story, as I did not expect to end up here. One Sunday, I did not feel well. It was last Sunday. I had a tremendous chest pain. I thought it was normal, and that it would pass. But 1 hour later, I felt awful, really bad. I asked a female fellow employee to take me to the emergency room. While there, they confirmed a suspicion of a heart trauma, so I ended up here. From what I remember, everything was happening very fast. As far as I know, the procedure consisted of deploying a device into my ventricle to open a vessel which was blocked. I never felt I had a heart problem, except a slight pain in my hand and arm, but nothing else. I feel very good. I really never believed that I had a heart attack or something like that.
What about care?
The care is very good. Really great, let me say. What comes next? As I have said, tomorrow I will have interviews about further rehabilitation to maintain my heart in good condition and not allow for another episode to happen. I think we will collaborate, the department and I, since they suggested I participate in follow-up exercises. Something like that. I will think it over, and I believe everything will be fine.
The symptoms of heart attacks can actually differ between men and women. Men tend to experience intense chest pain, pain in the left arm or jaw, and difficulty breathing. Women may experience the same symptoms, but the pain will be more diffuse, spreading across the shoulders and down the arms and back. It's important to learn what to look for and to be aware of in friends and family. Join us after the break for more from American Heart of Poland. Welcome back. We're in Bielsko-Biała, a town in the south of Poland, to find out more about the latest advances in cardiology and to discover more about the procedures and the rehabilitation of patients.
Yeah, in general, in Poland, we don't send patients immediately after surgery to their home. It's a mistake, obviously. This is the common problem with those patients, how to take care about them, for example, in US. So we have a little bit different system. So we send patient to our rehab center. It is a nice spa center where patient can recover after the major surgery under the supervision of nurses, rehabilitants and doctors. So if anything happen, we immediately help the patients without, some exaggeration of the situation which might happen at home.
To take better care of the heart, they should eat a little bit less. They should take care about their hypertension. They should care about their diabetes, cholesterol, and physical activity. These are the most important things to remember to keep their heart in a good condition. We do angiography, coronarography, angioplasty, coronary, and last year we have started vascular surgery, and we have a big building with almost 1,000 beds for rehabilitation. After the heart attack or acute coronary syndrome, it is very important for the patient to get rehabilitation. It gives them strength. It gives them power, and it gives them positive thinking that they can come back to normal life and normal activity. We are waiting for people from abroad to come to us because the quality of our medical staff is very high, and the cost is a little bit lower than in Western Europe. This is the reason for me the patients should think about medical tourism.
Usually patients after myocardial infarct or major surgery, they get depressed. They think that they are very ill, and it will be difficult for them to return to normal life. So they need definitely psychological support. We need to convince them that the treatment went very well, and just the patient needs a little bit rehabilitation, then the patient can come back home and return to normal life. So the psychological support is very important.
We are the resort spa, that's the main thing, and we are in the lovely city, as you can see, Ustroń, and you have beautiful weather as well. And the whole year it's very popular place, because during summer, of course, you can go outside and use the other stuff. But in the winter time, you have the ski slopes. So besides the treatment here in the building, as I mentioned before, it's usually the DPs and the salt water. You can use the other stuff here as well.
We perform various procedures. It's a treatment rehabilitation approach which patients with heart or other types of illnesses undergo. The clinic, in addition to its cardio intervention activity, namely cardiac and vascular surgery, also performs cardiac rehabilitation, which is the integral part of its scope of activity. We conduct consultations with a cardiologist using expanded diagnostics through treatment up to rehabilitation.
I'm a medical doctor. I'm a director of Center for Cardiovascular Research and Development of American Heart of Poland. I'm doing my own clinical work every day, but also I'm responsible for the research in this company. The research consists of preclinical and clinical work. The aim of this center is to develop new technologies which we can use in the clinical practice. We are trying to develop better, safer and more efficient therapies which can be used for our patients. It's very important because having so many patients in our clinic, we want to improve the outcomes, yes? You want to be treated in a safer way and a better way. You don't want to be hospitalized, re-hospitalized. You want to be cured in a relatively short time. You want to have a contact with your doctors. Everything is made by the research. So we are trying to find what is the best method for the treatment, what is the best device for the patient. So we are following our patients, we are collecting all the data, and based on this we can find the answer for what is the best treatment strategy. We are just a part of world science. We're taking a part in many clinical trials which are international trials. So people from Europe, people from the whole world, they recognize as a good clinical centers. They want to do the clinical trials with us. So since 2004, since we've opened our research center, we developed the first Polish bare metal stent. Then after that, we introduced into clinical practice first drug-eluting stent. And this device was the first device in the world which was covered with biodegradable polymer, making this device safer for patients, because theoretically patients who had these stents implanted could have shorter double antiplatelet therapy, making it safer in terms of bleeding complications. So this was our biggest achievement. Now we are working on many other drug-eluting stent technologies, drug-coated balloon technologies. We are also involved in many therapies related to hypertension treatment and structural heart diseases.
We can offer our patients the whole treatment, beginning from the outpatient department, diagnostics, invasive procedures, open heart surgery and vascular surgery, to rehabilitation process. We have all the units in the group.
Our contact with a cardiac patient is totally different when compared to patients suffering from other diseases. Patients with cardiac conditions should be treated both physically and mentally, namely make him feel safe when arriving here, but also rehabilitate him in a physical sense and at the same time change his lifestyle to a more healthy one. It means changing the diet, reducing body mass, adding physical activity, reducing everyday stress. All these are very important factors which result in further coronary incidents.
Our research program is a very important part of our activity, because we believe that to maintain the advantage on the market, we have to develop new methods of the diagnosis and treatment of cardiovascular diseases. So we have two parts of this program. First is preclinical testing of new devices, And the second one is introduction and testing the new devices in our patients. We of course follow all ethics rules related and good medical practice related to this kind of research. We cooperate with centers and hospitals in the UK, in the European Union, as well as in the US. So we are a part of the worldwide network for running multinational, multi-center trials, clinical trials, but we also do a lot of work, preclinical work, a lot of research for new startups from Europe and US. So the advantage of having such a possibility is to get the new technology as a first center. So it's an incredible advantage. And when the new device or new methods introduced to the market as a new one, we have already experienced how to use it. We have to learn patients teach patients how they should, prevent further progression of the disease. This is very important. Many of them are smoking cigarettes, so again, psychological support to give up smoking is extremely important for further prognosis, a good further prognosis. So we are always trying to convince people to use this time to give up smoking.
Your health is a vital ingredient for a varied and fulfilling experience of life. Prevention is most definitely better than cure, so maintain an active lifestyle, eat healthily, and speak to your doctor if you're worried about any potential symptoms. Heart disease can be hereditary, although not necessarily so. But with the latest advances in cardiology, it's possible now, more than ever before, to be able to carry on living your life the way you want to.